Firstly, so I'm David Seymour. I'm the Alliance Executive Director at Health Data Research UK, which means I sort of convened the UK Health Data Research Alliance that brings together different data custodians across national bodies, NHS trusts, research cohorts, medical research charities, and our health data research hubs. And actually, this is all part of HDR UK's mission to unite the UK's health data to enable discoveries to improve people's lives. With a 20-year vision for large-scale data and advanced analytics to benefit every patient interaction, clinical trial, biomedical discovery, and enhance public health. You'll see within there's not a lot of mention of social care data when the Institute was first set up, but it's quite clear, obviously, to anybody working in this field, particularly with the most vulnerable, that social care is a vital component of that sort of holistic view to understanding more about the individuals, understanding the quality of life for those people, and therefore vital for their research. And I guess that brings a bit to the background and the timeline to this workshop. And I thought it was perhaps just worth sharing for a few points really. Firstly, a bit of what a difference a year makes. So actually, this meeting was initiated on the back of the NIHR ARC induction meeting, which was held in a windowless room, a fairly crowded room in London, back in the 14th of October, where we then all sort of gathered around for coffees and things at the breaks, somewhat different to our day to day. And then John and I had a sort of an email exchange because we hadn't managed to meet up in the piece, and then we actually set up a conference call, but it was a telephone conference call, even though we did actually have Zoom within our organisation. The logical thing was to jump on a phone call. And we had a couple of follow-up actions. One was to encourage the NIHR ARCs to consider our Better Care call within Health Data Research UK, and it was fantastic that they did, and that we have both the Southwest and the North now represented through those partnerships. And secondly, to jointly host a workshop on social care later in 2020, is what we said at that point. And so here we are today on Hop-In. Obviously, what happened in between doesn't really need us to go over it, but there were three things here really that I wanted to draw out from the very latest on the deaths. And it's a pretty sobering thought as to the challenges that we have within health and social care, and how we've managed to respond to the pandemic, but perhaps some indicators of hope as well. We're all very familiar, I'm sure, with the incredible amount of excess deaths the care homes experienced during the first wave of the pandemic, but actually are the glimmers of hope in the fact that we haven't seen the same level of repeated excess deaths during this second wave. What do we know about quality of life, though, within that instance? And I guess another big black hole is then what do we know about those people, which is actually the majority of people receiving social care support in their own homes, particularly the most vulnerable, and particularly those, say, with learning disabilities and the younger end of the spectrum as well. So plenty of unanswered questions, but perhaps a glimmer of hope that actually COVID has accelerated our research in these areas and actually enabled us to make a difference. I just want to close really by saying what a fantastic range of presentations there are coming up and how well they align to HDR UK's strategy for delivering on our mission, which is all around uniting the data, improving the data, and using the data. And as we go through today, you'll see that there's a number of different sessions, from strengthening social care analytics to development resources for a minimum data set for care home adoption, development of potential national social care data set, improving the patient flow between acute, community and social care, potential of individual linked social care data for research and analytics through the use of routinely collected data to improvement of good quality public involvement, and finally with our parallel sessions this afternoon.